price your medical services. This is one of the mental confusion in presence of doctor's mind. In doctor's mind, there is a bit of confusion whenever a time comes when he has to tell his price. Why there is such kind of hesitancy, that we will see today. Many doctors with whom I have interacted, they told me that whenever we are telling patient about charges, there is certain kind of fear in our mind. What kind of fear? So then they say, we have a fear that patient might run away. We might lose the patient. The patient will feel that our fee is exorbitant. So how to manage it? So I'm just sharing few of my thoughts with you here. And any query you have, you want to share your experience, you can put it in the chat box. Okay. So we will see it in the chat box, and I will try to answer. Now see, price of your treatment. Okay. So when we are talking about price of your treatment, we have already taken for granted that the patient has come to you for consultation. Patient is sitting inside your consultation chamber. Patient has been examined by you, and now say you are a gallbladder surgeon. Now they are asking you, "Kitna kharcha hai? What will be expenses?" Now at that time, how to decide your charges? I will tell you grossly, there are few elements which you should take into consideration. Like, what is that particular treatment consist of? Does that treatment consist of using any high-end or costly instruments? For example, the camera which you may be using, is it disposable for one patient? If you are using any stent, then once you put it, then it's gone. Then the charges has to include that cost of disposable items. In cosmetic surgery, plastic surgery, when we do liposuction, ultrasonic cannula is there. So after one or maximum 2 episodes, we have to throw it out. So that cost is a fixed cost. So you must consider what are your fixed costs while you are telling your price to patient. Fixed cost means cost of consumables, cost of disposable items, cost of operation theatre rent. If you are attached to any hospital, then you must know what are the charges according to their categories: first class, second class, general ward. So you can guide patient on, because those charges are fixed charges. Next is how much hospital is going to charge well and above the consumables. Sometimes, many times, a laparoscopic surgeon, she has to get her own camera or her own set of instruments to the hospital. Then is a hospital going to charge that particular patient about your instruments? Or are you going to collect that charges directly from patient? So that's what I mean by disposables, consumables, and instrumentation necessary to perform any procedure. Next thing about the charges is what after finishing your procedure. If you have taken biopsy, then you have to send a biopsy to histopathology or certain pathological analysis. Then that charges must be told to the patient in your consulting chamber itself. See, otherwise the patient will think now the doctor is increasing his charges. पहले हमको इतना बोला था, now laboratory charges, path lab charges has suddenly come. Okay? So all those things you must explain. So these are the kind of fixed charges. Next, variable charges. The only variable charges are your own charges. From 0 to infinity is the range for your charges. Now, if you are in private, your own setup, then your charges, whenever you are formulating your charges, there are certain parameters. The first parameter you must remember is what are the prevalent charges of that particular procedure done by person, by a doctor of your caliber. See, if you have spent 15 years into medical or surgical profession, then a doctor who has spent 15 to 10 years in medical profession, in surgical profession, how much is their charge? That you must know. If you have started practice recently, so let us say whatever is your qualification, but you have got only 1 month experience, then you must know how much charges are being charged by a doctor who has got 1 month experience in your vicinity. Most of the time, this is done is a freshly passed doctor when he starts private practice. That time, he compares his charges with the one who has got 20 years of experience. And then there is disturbance, and then depression, and all the other problems. Then we blame the patient is not ready for operation. And then how to convince the patient. Many of you have joined our training on how to talk with patient, how to do consultation so that patient follows your advice and is ready for your treatment in first consultation itself. So in that program, we have given you step-wise ladder how to tell your charges to your patients. It's a sure shot for them. And many of you are using it. That's good thing. But in nutshell, I will tell you. So now let us see you have examined the patient and now you have finished your examination and you are telling charges. So as I told you, what are the charges prevalent as per a doctor who is at your part. The second thing is what are your minimum acceptable charges. Okay, minimum acceptable price. So that particular price must be acceptable to you at all times. So that is called as your MAP, minimum acceptable price. Minimum acceptable price. So when you get that particular price, you should be happy. Whatever comes above that is your bonus. And if you don't get your MAP, then do not operate or don't do that procedure. That should be fixed in your mind. Another point is sometimes you might have to share your charges with hospital. Then you have to take that factor into account. Another mistake done by doctors is a doctor who is highly qualified and has got good experience, high experience, let us say of 20 years, and his charges are high. Now what happens? Because of his charges, gradually patient don't come to him. Gradually his practice decreases. Then what he does, he starts charging minimum amount and does the cases. Then he says, practice must run, patient must come, OT should be full. So even though he is highly qualified and senior most doctor, he might operate patients in minuscule charges. So how much charge you should take is entirely up to you, according to your comfortable level. You should be comfortable, you should be happy that yes, I have received X amount, I am happy, and I am going to operate on this patient and I am going to make this patient also happy. friends, these are few thoughts which I wanted to share with you. Because Happy Doctor Foundation always aims at doctor's happiness first and at the same time patient's happiness also. Doctor alone cannot be happy if the patients are not. And patient cannot be happy if doctor is not. So at Happy Doctor Foundation, we always strive to balance this happy doctor and happy patient relationship. And most important guide is to follow value triangle success formula. I think 90% of doctors they have downloaded our Happy Doctor Foundation's value triangle success formula PDF file from our website. That gives you full guidance as to how you can create value for your treatment, how you can create value for yourself, and then present those values to your patient. So the patient is ready to pay you the charges which you really truly deserve. So friends, if you have any more queries, questions, doubts, you can mention it in the chat box and comment box and it will come to me. Okay. Thank you. See you in our next video. Keep in touch. Bye.